Good afternoon, everyone. Thank you so much for joining the ACSD Merit-Based Incentive Payment System webinar, otherwise known as MIPS. We just want to go through the agenda really quickly. My name is Jannette Hanna, and I'm on the quality team here at STS. I'm joined by my colleagues Carol Crone, Leanne Jones, Banu Yaja, Mark Antman, and our director, Donna McDonald. Also joining us are our colleagues from IQVIA, including Melanie Bent and Jannette Hanna. Today during the webinar, we'll provide a general MIPS overview, and then I'll turn it over to Melanie to give a demo of the platform so that you're able to see the consent enrollment process. And then we'll reserve the few minutes that we have left at the end for Q&A. Okay, so as you may know, MIPS is a CMS program designed to promote reporting of quality information by eligible professionals. We're pleased to announce that the STS National Database was approved to be a qualified clinical data registry in 2020, also known as a QCDR. A QCDR is a CMS-approved entity that collects clinical data on behalf of clinicians for submission to CMS. And the data submitted to CMS via QCDR will cover quality measures across multiple payers. In 2020, MIPS is available to STS Adult Cardiac Surgery Database participant surgeons only. As in previous years, the cost to participate in MIPS is free to STS members. However, there is a small fee for each surgeon who is a non-member, and the cost is $500. And many of you may know, and for those who have participated in MIPS in the past, or whose surgeons have participated in MIPS in the past, the enrollment form was previously housed on the STS website as a web form. But due to our data warehouse transition to IQVIA, we're happy to announce that new in 2020, the MIPS enrollment consent form is now available in the platform. And the IQVIA team, with guidance from STS, is in the process of developing a MIPS dashboard. Additional information is provided on the MIPS reporting page on the STS website. The link is available on this slide. I'm going to go ahead and turn it over to Melanie Bent now so that she can provide a demo of the MIPS enrollment consent within the IQVIA platform. Melanie?
Okay, thanks, Jane. I'll go ahead and share my screen. Okay. Just let me know when you can see my screen.
You can see your screen.
All right. Thank you. All right, so I'm already logged in. I'm logged in actually as a surgeon reviewer. So for some, this may look a little bit different, but the navigation in regards to where you'll be accessing the MIPS consent form, you will have that menu option. So once you log in, you will take a look under the resources menu, and you'll see there's an option for MIPS participation. Once you select that option, you'll see a hyperlink that's listed as MIPS 2020 participation. And the only thing when you initially go in that you will see is this first entry. I added some just for the demo purposes, but the main focus when you initially go into this area will be to add a new form. So you'll see the option where it says add new MIPS 2020 participation, and you'll see that there's a hyperlink here that says add new. You would select that option, and the form will display for the 2020 consent. And so you would go ahead and review the language here, and then you'll see that there is an option where it says I consent to the terms and conditions of MIPS 2020 participation. Once you select that option, you'll see that there are multiple fields that are now enabled. And you'll notice that each one of those fields are, of course, highlighted in red. So that's indicating that the field is required. So the first field that you will enter is the NPI. So if it's an NPI that you know specifically, you can type that in, and the automatic search will kick in. This actually does look at a master list of NPIs, so you will be able to locate that by typing in that information. Or if you wanted to do a search, you have an option for advanced search. So I'm going to select that for you. And you'll see another dialog window that appears for the advanced search. And here you can enter in the NPI that you're searching for, or If you're not sure of that actual ID, and we're of course enrolling an individual provider, you select the radio button for individual providers and you can do a search by name. Okay, so I'll use a provider here that I am familiar with. Let's do Ingram, James. If you know the city, you can put the city in. And then of course the state. If you don't know the city, not sure, that's fine. You can leave that blank. It's not required. You'll notice that there's nothing here that is basically forcing a requirement. So I'll just go ahead and put in that criteria and do a search. And then the system will go ahead and do the search for this provider. I believe it should be listed as James. Yep, good. So then once it locates that provider, based on the details that I provided, it will list any matching records down below. So you'll see that here. You'll go ahead and select the radio option next to the name, and then select the option to add codes. Okay, you'll see that it populates that information in here for the provider, and then the next field that you will enter is the TIN. So for the tax identification number, you can go ahead and enter in that value. We do have validation on this field, so if I were to enter more than 9 characters, because that is what is expected, and we do need that formatted correctly in regards to the 9 characters. Once we have that detail in there, if it's more than 9 characters, it will give you a validation message to let you know that it must be 9 characters. Okay, so you'll see that information. Once I remove the additional characters and tabbed away, the validation goes away. All right, so it does enforce to make sure that the formatting, so we do not expect you to add any additional characters such as a hyphen. It is just the ID as is without those other additional characters. Okay, so if I have more than one tax ID associated, I could go ahead and add an instance. And so you would select that option that says add instance, and you enter in the secondary tax ID number. And it will go ahead and store those with the associated NPI. If I entered that in error, you do have an option where you're able to delete that. So just in case if you were to click this by accident, you can go ahead and use the delete option to remove that entry. Okay, next you would have your preferred phone number. So you would just enter in your phone number here. You can put in formatting of hyphen, parentheses, it will accept that. So that's fine. Just wanted to let you know that you can enter that. It will allow you to enter in that information with hyphens or if you did parentheses, okay? And then for the preferred email address, it does expect the format of the name, the @ symbol, and then the domain. So in this instance, I would put in the valid contact email, which would be formatted as such. If it did not have the correct format, it will give you, it will basically indicate that a valid email, as you're seeing there, needs to be entered. So let me just leave it as this. Yeah, it will at the time of saving, I believe, but it does expect for you to, of course, enter in a valid email. Once you enter in all of that information, you do have the option to save. Save will just keep you on the same screen, but if you are finished, you can hit save and exit. Okay. All right, once the form is saved, you'll notice that, and I did this for demo purposes, especially for those participant sites that have more than one provider that is participating in the program. You will, of course, as each consent is created for each provider, you will see the running list of those consent forms per provider. If you needed to go in and make an edit, you would select the hyperlink for that consent. It will bring you right back to where you were, And if you needed to make any changes on here, you would do that. And then of course, hit save or save and exit. If there's an instance where the provider does not want to participate, they want to unenroll from the program, the way that you would do that is by deselecting the consent option. And so I'll go ahead and show you for this purpose. You'll see that once I deselected the consent checkbox, all of the required fields were then removed and cleared. Okay, so if I were to select it again, you'll see that the fields will come back, but all of the information that was previously entered basically was cleared out. So please just be mindful of that. You know, if you were going in just to kind of test it out, just know that once you deselect, it will clear out all of that information and you would need to re-enter that detail, those details. Okay. And so in this instance, what can happen if you wanted to, let's just say that that provider disenrolled, but then you had another provider, you can actually use this same form and put in that associated provider's details and then save. You wouldn't have to create an additional entry. You could use the one that if you had to update and if by chance you had another provider that you needed to enroll, you could actually use that form, this form, enter in that, and then save. Okay. In this instance, I'll go ahead and save. Hold on. Oh, of course, see, just in case in regards to if I did not enter in all of this information, you see that it does give you the message to say that all of the fields are required and they're required in order for us to save. So I'm just going to deselect that. It will leave that entry. So this one will still appear down at the bottom because it was initially used, but it does disassociate the provider. You'll notice that there is no NPI that's listed. So, but it will stay here on the list. But again, if you needed to enter maybe another provider, you could use this entry and then that new provider would be associated. Okay. So that is the process of going into the system and accessing the consent form and adding a consent form and editing a consent form. We also have, just for reference, a user guide that walks you through the same steps to allow you to review just for any reference as you're going through this process. All right, so Jane, I'm going to stop here. And let's take a look. I think we may have questions that may have been submitted.
Yes, that sounds great. I'll just pull up my Q&A slide real quick here. Okay. Thanks, Melanie. So we'll begin the Q&A, and then Melanie, I'll probably need you to chime in on some of the technical questions. The first question is, can you still use paper enrollment? The answer is no. We are asking everybody to use the online consent form that's available through the platform. It's just easier to track that way, and it will be integrated, I believe, Melanie, with the MIPS dashboard as well.
Yes.
So we'll need to, all that information needs to be contained within the same place. The next question, ACSD version 4.2 no longer uses tobacco cessation counseling as a single element, but instead has a substance use NQF element, which encompasses alcohol, tobacco use, and drug use. Is tobacco no longer a MIPS measure? I still see it on the STS website as a MIPS measure. Has this measure been replaced with the substance abuse or substance use screening and counseling element?
I can take that one, Jane.
Thank you.
Yeah, that's all right. We still do collect the tobacco use field. The sensation if your patient codes yes to tobacco use at tobacco use sequence number 400 and codes yes to one of those fields, that's when you would give that counseling. It's included in that that discharge, the discharge field that asks if they received counseling for appropriately screened, yes, smoking or alcohol or illicit drug use.
Thanks, Carol.
Mhm.
The next question is there a way to tell if cardiac surgeons were in the system for 2019? There isn't currently a way to do it within the IQVIA platform, Katie, but if you email stsdb@sts.org, the operations team on the quality team would be happy to help you. The next question, the doctor is supposed to be entering this, correct?
So it could be the doctor or also the doctor's delegate that could go ahead and do the consent.
Thank you. So for just to provide additional information on that, if you are a vendor-based participant, you are either a primary or a backup data and file contact, you would have access to the MIPS consent forms within the IQVIA platform. If you're a direct data entry participant and you are a primary or backup direct data entry contact, you would also have access to the MIPS consent form. The next question is, can STS reference how many providers in general participate in MIPS? I would like to share this information with my leadership. Thank you for your question, Heidi. I believe in 2019, it was several hundred participants, and may need to defer to Donna for her guidance on that. She might be on mute.
I know that, Jane, this is Carol. I know that there's Donna.
There. We've been as high as 800, but as more and more physicians become hospital employees, their hospitals are submitting on behalf of the entire medical staff. So we've seen the count go down, and it's been between 200 and 300 in the last couple of years.
Thank you. The next question is, if my surgeon has not signed into IQVIA yet, I direct them where to sign on. You can actually, why don't you have them email stsdb@sts.org, and the operations staff will help reset their passwords to get their login information for them. The next question is, I heard yesterday that the MIPS consent can be done by data managers. Is this correct? But all surgeons should have a login for IQVIA to complete themselves, correct? These credentials would have been sent when we moved to IQVIA. So this is a three-part question. I think we addressed the first one already, but just to reiterate, yes, data managers do have access to the MIPS consents within the platform. All surgeons who were participant surgeons as of the official launch at the end of January for adult cardiac would have received their user credentials. And if they are having difficulty locating that information, please have them email STSDB, and we'll be sure to resolve that issue for them. But yes, they were all automatically sent to not only data managers, but also surgeons and anesthesiologists for ACSD at the end of January.
This is Jannette from IQVIA. Just to add a little context there, we definitely would encourage your surgeons to take a look at this, to connect, to enroll themselves if they can. But we also recognize and understand that, sometimes people are really busy, or they just don't have the bandwidth to get in there and tackle this on the timeline you would prefer. So that's why the other team members, the data managers, are also able to assist the surgeons with that enrollment.
I think this is Donna, one important thing to keep in mind though, the NPI we can verify, and Melanie demonstrated how it'll match up with one that's in the system. When you start to type in the number, or if you look up by name, we can verify that that's a real existing NPI. The part that gets tricky is the tax ID number. You have to be 100% sure of the tax ID number or numbers that physician uses to bill Medicare. We have rejected or been unable to submit files for many surgeons or get a response from CMS when the file is submitted saying there's no claims data on file with that NPI-TIN combination. So again, there's money at stake here. You want to be extremely careful that the right numbers are being entered, because CMS will reject it if it doesn't match what comes in through claims.
And that will also need to match the NPI and the TIN numbers on the surgeries that are submitted. into the system. So definitely be careful about that on the enrollment form, but also please make sure that the information going into your vendor systems or abstracted related to the surgeries also aligns with that, with particular focus on your MIPS participating surgeons.
Thank you both. That's very helpful. The next question is, do we do this or do the surgeons go into IQVIA to sign up? Again, as Jannette and others have stated, the surgeons do have access to their own MIPS consent forms. Data managers do as well. So we defer to you on that. Okay. Next question, how do we know if our surgeons have been enrolled previously? If you wouldn't mind just emailing stsdb@sts.org, we'll be able to look into that for you.
But it doesn't matter because we need a new consent every year.
That's absolutely right. Thanks, Donna. That's helpful.
Sure.
From Teresa, we sign in with our password, then enter each surgeon's name, NPI, and TIN, correct? That's correct.
That's correct. But all the required fields, remember, there's also the preferred email address and also preferred phone number. So all fields are required on that form would need to be entered.
And that would be,
it should be the surgeon's contact information and
Yes,
not the
thank you,
data
Donna.
manager.
Correct. Correct.
yeah, whoever the point of contact to discuss or address any concerns. If, for example, something needs to be adjusted or we need to reach out with regards to the enrollment.
Thank you. And I believe in addition to the recording of this webinar, we do have a MIPS consent enrollment guide available as well. I don't know if are we posting that within the platform or posting it online? Either way, we'll make that available to you so that you are able to refer to it when you are using the form. The next question, is the deadline to consent still the end of October? Donna, may I defer to you on that one?
Sure, we were just discussing this before the call started. Traditionally, it's been October because we depended on a different reporting mechanism. Now that we have dashboarding, I think we can extend the deadline into December. So it will be later than the end of October. I don't have an exact date for you yet, but we'll make sure that emails go out to all of the participants in the adult database.
Thank you. Will this be a one-time consent for surgeons or yearly? This is actually an annual consent. So even if folks, as Donna was mentioning earlier, even if folks were enrolled in to report MIPS data last year, they would have to re-enroll or consent again for 2020. The next question, did you say that MIPS is not mandatory?
It is not.
I would again, thank you.
It is not mandatory, but there is a penalty for those who don't do quality reporting in some way. The hospital may be doing it for your physicians. They may be in some sort of advanced payment model. Every hospital or hospital group are a little bit different. So you'll want to check with your quality people to see if they're already doing physician quality reporting through some other mechanism.
Thank you. The next question, I may have missed it as I was interrupted during Melanie explaining, but can we print this for a legal review? And if not, how do we get them access? So I think the question is, can you print the form from within the platform?
Hold on, I actually was checking that.
You could probably screenshot it.
You can screenshot it, and I think you can, I'm trying to test it right now. It looks, you can to PDF, it looks kind of, it does allow you to print to PDF and print to a printer. I can show you, but it is available. But yes, you could also do a screenshot. Let me just show you since I have it open.
You also could screenshot the list of forms enrolled to that participant to see all the NPIs that are enrolled without needing to go into each in turn if you needed a summary view of all of the surgeons enrolled.
Okay, let me just show you what I did. So all I did was right click. So within the menu here, you'll see there's a print option. But it does allow you, it does give me, these are all of the things that I'm enrolled in, so you wouldn't see all of that. But here is the actual consent. But it's probably prettier if you were to do the screenshot option. And here's the option where I can save as PDF, or if you have a printer connected, then it'll give you a printer option. Okay, I'll stop sharing.
Thank you, Melanie. To share my PowerPoint here. Okay, the next question, it's a follow-up question regarding the tobacco counseling measure. So to clarify, since on substance abuse element, if a patient was to receive tobacco counseling but not appropriate alcohol counseling, I would code no, and so this would adversely affect the MIPS measure, but the patient did in fact get tobacco counseling. Carol, is that, should we take that question offline so we can look into it a bit further, or is that something we could address live?
Hold on 1 second. Let me pull something up here.
Okay, no problem.
Check on the data collection form real quick.
Okay, we can come back to that one and when you're ready.
Sure.
Should we do that? Okay,
Yeah,
great. Absolutely. The next question is, when is this form due each year? Where's the due date located? As previously stated, we have the ability this year to extend the deadline into December. And as we are making updates to the STS MIPS reporting website, we'll be sure to update that information as well. Next question, if the surgeons do not wish this, do we still have to fill out the form? No, we only need the consent form completed for those who would like to opt in for MIPS reporting. Next question, so if your hospital is doing this as an organization, then the surgeons don't need to submit consents? Well, I'm not sure if I know how to answer that question.
I think we may need to take that offline. Many hospitals will handle their own CMS submissions and do a group submission from their, with tools that they have centrally. That would be different than this, but we wouldn't want to advise you not to pursue this route if there was any misunderstanding about the way your CMS submission would go in. So perhaps let's take that one offline. If you reach out to the STS email address, then we can talk more specifically about your particular situation.
Okay.
Thank you for stepping in there, Jannette. Go ahead, Carol. Are you ready to go back to tobacco?
Yeah, I am. And I just,
Okay,
I want to
sure.
run this one by Donna because we had removed the smoking cessation, which was in 2.9. We removed that and replaced it with this substance use screening and counseling performed. And I think this is a good question that Bonnie brings up. Do you have any insight into this? Previously, we had the tobacco cessation counseling performed, yes or no, and we've replaced it with the substance use screening counseling. What do you think on that, Donna?
I see what the problem is because we don't have cessation for smoking alone. It's bundled into that other measure. So you're right, this would not be a good measure for that patient, for that surgeon. They would get dinged here. But the bar, again, is 50%. So missing it on one patient is not going to be problematic. It's only if it's a repeated problem where patients are getting counseled on some things and not others.
Would we, thank you. Would we ever include this NQF 2597 in our MIPS reporting?
It's now in another CMS program, in a bundled payment program that's, I'm not sure when that's going to start, or if it is, there's been some delays due to COVID. It's possible if we were to participate in MIPS again next year, but we haven't made that decision.
Okay, thank you.
Thank you both. I just wanted to note that Leanne was kind enough to provide in the chat box the STSDB email address. So again, if you have any general questions regarding MIPS, please feel free to send questions there, and then we'll be sure to get back to you after internal review. Thanks, Leanne. The next question is, what are surgeons seeing in IQVIA? Do they see the same things we as data managers see? I guess I can start, and then maybe I may need to defer to you, Melanie and Jannette. But what folks see in the platform is related to the roles to which they're assigned. So data managers are generally, uploaders. We also have read-only roles in there. So if you're a data manager, so a primary or a backup data and file contact, or primary and backup data file contact, you would see the uploader, you would see your MVR, harvest summary report, pretty much all the reports that are available you would see. Surgeon reviewers would not see the uploader and the associated DQRs that are related to the data uploads. Am I saying that correctly, Melanie?
Mm-hmm. You are.
Okay, thank you. And then report viewers would have the same, report viewers, which are also a read-only role, would see what surgeon reviewers would see.
But the surgeons would have access to the missing variable report, to the harvest summary report, to the non-risk adjusted dashboard, and then the links to the case details or to the surgical case. They can link and then also view those forms to see the full surgery data set on each form if they're interested in doing that. They will also see the same interface that Melanie showed earlier today for the enrollment option to fill out and save that enrollment form.
Thank you. Next question, please describe the specific financial benefits estimate of usual CMS reimbursement for signing this consent. This is a tough question, and we actually have not had a chance to post that online, but it will be posted on the STS website shortly. So I apologize that we aren't able to address this live, but we'll be sure to get back to you on that.
Yeah, and it is a budget neutral program. So the amount of bonuses paid out depends on the amount of penalties. So it's not, we can't say you'll get 5% or 3% of your Medicare bundle. It all depends on what the data look like.
Thank you, Donna. Next question, are the MIPS measures listed on the STS website? Yes, they are. There's actually, if you go to, let me actually go to the web. Hold on one second here. I'm going to pull it up and then I'll share my screen again. Okay. Okay, so if you go to the STS National Database page and you scroll down to where all the important resources are, you'll see that there is about halfway down the list, we have the merit-based incentive payment system, the MIPS page listed here, and then at the bottom you'll see a list of measures provided. Again, we are updating this page within the next week or so, so you'll see updated information in here. But for now, I think it would be a good resource for you to utilize in the interim.
And Jane, I also added that to the chat, the link. So they have.
Oh, thank you, Melanie. Thanks.
You're welcome.
Great. Okay. Let's see, going to the next question. If the surgeons enter the consents themselves, how does the primary data person know who is signed?
So each user who has access to a participant can see in the MIPS participation area what NPIs are enrolled. So that would be available and visible. It's not like you would not see everybody who's enrolled in the list because you didn't fill out the form. You would still see the enrollment of the surgeon at your participant.
I just panicked there for a second, which is why I said gosh, but I'm relieved to hear that. Thanks, Jannette. That's great. Another question from Bonnie. Are all team members that were listed for a facility for ACSD should have received credentials, such as my quality team that was listed? Is that correct? Yes, that's correct. So at the end of January, when we launched, everybody who was listed on for your PID within STS's records received a login. That includes roles like primary and backup data and file contacts, national report recipients, DQR recipients, and all the physicians. So surgeon rep, surgeon, anesthesiologist rep, and anesthesiologist. Next question, where can we find our facility's current participant contact forms at? That information used to be housed within the DCRI report portal. With the data warehouse transition to IQVIA, we are actually tracking participant contacts within STS's records. So if you have, if you'd like to receive an updated contacts list, please use the email address that Leanne provided in the chat box, and we'll be sure to provide that to you via Excel or any other format that you prefer. Okay. Next question, do the email regarding MIPS also go out to surgeons? I don't think we've sent an email regarding MIPS yet.
But right, it will go to all surgeons, all participant surgeons in the adult cardiac surgery database.
Thank you. Next question, will surgeons receive an invitation to complete the MIPS consent and directions on how to get access to IQVIA? We'll work on an email blast regarding that, and as Donna stated, it will go out to all surgeons participating in the database, as well as primary and backup data and file contacts. Next question, is there no signature required, and how do we know if the hospital is sending that data?
It's an electronic signature when you consent. And as far as what the hospitals are submitting, everyone is different, so I don't even know who to tell you to contact at your hospital. I would suspect it would be someone in the medical staff office or quality department who would know how the hospital is handling quality reporting for CMS.
Thank you, Donna. Next question, is this for adult cardiac only? I am thinking about my congenital surgeons that signed last year because those surgeons are not signed into IQVIA. I believe last year what we offered MIPS reporting for adult cardiac and general thoracic surgeons. This year it's adult cardiac surgeons only. I don't believe congenital surgeons ever had the option to participate in MIPS, but I would defer to Donna on that.
Now, they typically don't have a big Medicare population, the congenital surgeons. So there aren't measures specific to them, and we have not offered it to them. There also weren't enough measures for general thoracic. A lot of the ones that we wanted to use were topped out, and CMS didn't accept them.
Thank you. Next question, we only have one place for TIN in our vendor software. If we put in more than one for a surgeon and it is not the one that is the one shown in our database, how will that be used for our surgeon's benefit?
You would only use the TIN that is associated with the case record. So it sounds like in this instance, you only have, even though they may have more than one TIN, in your actual software vendor system, you only captured one, and that would be listed on the case. So that's the TIN that you would use for the enrollment.
So each surgeon NPI can have multiple taxpayer identification numbers, and those would be listed on the enrollment form. However, for each surgical case, those are generally only associated with one taxpayer identification number. So with the multiple TINs entered on the enrollment form, the system will automatically grab all of the surgeries associated with that NPI, and then any of the TINs, of which there may be multiple, entered on the enrollment form, and bundle those up to all go to CMS. Otherwise, if you only enter one, if there's only one relevant for that surgeon, then the match will only occur on the one TIN that's been entered in the enrollment area. But there should be only one on each surgical form.
Thank you. Next question, we have 5 left. Thank you, team, for sticking with me. Do the surgeons need to be up to date on their membership? If they are not, will we get an error? We will accept, as long as the surgeon is within the system, we will receive or will be able to process the consent form. The invoicing will be done separately. We do encourage you to have their membership up to date. You will not get an error. The consent form will be accepted, but if their membership is not up to date, they will receive an invoice for the non-member fee. Next question, is this consent form the same as the data sharing consent and release from physician quality reporting system?
Well, it serves the same purpose, but we no longer have a paper form.
It replaces it, right. Thank you, Donna. Next question, if as a data manager I do this form, when my surgeons log in, will they also be able to see this as well? Is it site specific? I believe Jannette may have answered this earlier, that you would be able to see the consent submitted. Is that correct, Jannette?
Yes, that is correct. So the enrollment would be visible at the participant in which it's entered. However, we do know many of our surgeons are affiliated with multiple participants, so they would not need to enroll multiple times, would only need to enroll once. But that would remain visible to everybody who has access to view the participant in which the enrollment is entered and saved.
Thank you. Last few questions. Are all the MIPS measures used or the top performers? Can tobacco screening be avoided and focus on the others?
At this time, all of the MIPS measures are used based on the data that's entered in the surgical forms. So if any exclusion criteria is met, that may cause the surgical case not to be counted for a particular measure. However, the measures are calculated for all enrolled surgeons.
Okay, thanks. And final question, do all of those people with access to IQVIA, the IQVIA site, get notifications whenever I do uploads?
No.
I'm wondering,
No.
okay, I'm wondering
They
if this
do
is a question regarding data file uploads, so not really MIPS related, but
Yeah.
Melanie states no.
No.
So all users that a participant would be able to see the upload history in the upload interface, but there would not be any other sort of notification, no emails or anything like that going out.
Great, thank you both. I'm not seeing any more questions in the Q&A function, and we are ending a little early today, but if anybody has additional questions, please feel free, as stated previously, to contact stsdb@sts.org. We'll be sure to discuss internally who best can address those questions, and we'll get back to you as soon as we can. In addition, we'll work on an email blast to announce the availability of the MIPS consent enrollment within the IQVIA platform, and that will go out to adult cardiac surgeons and data managers. Thank you to the IQVIA team and the STS team for joining and definitely helping me, because I did not know the answers to all these questions. So I appreciate your guidance here. And oh, I'm seeing some additional questions pop in, sorry. Really quickly, surgeons have to sign an electronic consent annually for each facility where they work. Is that right? I believe it's not by the facility. It would be the surgeon's NPI and any tax ID numbers, correct?
Yes, and they would need to do that each year, but only once for the adult program overall. So they would not need to do it once per participant or once per tin. They can enter multiple tins on the single enrollment form and then just only enroll that one time.
Thanks for that. Okay, great. Sorry, there's one more question. So if they sign at hospital A in town, then it applies to the hospitals they practice at?
Yes, that's correct. So the NPI will be saved, and so we'll utilize the NPI and TIN information that is entered in the enrollment form. And then even if that same NPI and TIN are submitted by multiple participants or for multiple hospital sites, then the system will automatically do that match against the NPI and the TIN numbers exactly as entered on the enrollment form. Got to match. As long as those match, whatever's put on the surgical forms that are submitted, we'll grab it from all participants that it's submitted at, bundle it all together, and that will be visible in, we're building MIPS measure interface, and there will also be a sort of interface called the preview submission report, where the calculations of the overall measure results can be reviewed and approved prior to submission to CMS. And that would include data from all participants, as long as it matches that MPI and TIN number entered on the enrollment form.
That's great. Thanks, Jannette. And I think it will be helpful for everybody when you have a visual to refer to. So once that MIPS dashboard is available to you, it'll probably be much clearer how all of it's integrated and what data you'll see. Okay. Once again, I just want to thank everybody on the teams here for joining and helping me with the questions. I appreciate your time. Thank you all the attendees for joining. We'll be sure to send updates and additional communications within the next week or so. Have a great rest of your day.
Thank you, Jane.
Thank you.